So again, welcome everyone to our first webinar with Profound Aesthetics. We're here to announce our brand new UltraClear treatment. This is our virtual launch event with the one and only Dr. Samaan and Nurse Christiana. If you have any interest in laser treatments or in rejuvenation, we're going to explain what this laser is all about and what it can be used for, why you might consider it over other treatments, and why we're so excited for this new device. We also have a promotion, so make sure to stay tuned until the end of the webinar and I'll explain how that works. And then again, before we get started, let me introduce our wonderful speakers to you. I'm pleased to introduce Dr. Samaan, who is board certified family physician who earned his medical degree and completed his residency at the University of Nevada School of Medicine. And after more than 7 years of practicing family medicine in Newport Beach, he shifted his focus to aesthetic treatment, combining his medical expertise with his passion for helping patients look and feel their best. And in 2020, he founded Profound Aesthetics, where he brings advanced training and artistry into every treatment. And we also have Nurse Christiana with us today as well. And she's passionate aesthetics and nurse and mother of two. She earned her bachelor's degree in biology from Chapman University and began her career in plastic surgery, where she really started to hone her skills in aesthetics and her love for patient care. And for nearly a decade, Nurse Christiana has specialized in injectables, laser treatments, and has become a respected educator in the field as well. And she's known for her focus on natural looking results and for helping patients feel confident and celebrate their individuality. And so with that, I'll pass it over to you, Dr. Samaan.
All right, guys, thank you so much for your patience and for joining us. Thank you for the introductions, Hannah. So the UltraClear Laser, why did we decide to get the UltraClear Laser? The UltraClear Laser is not your average laser that you can find at any medical spa. It's like a dermatology grade laser that treats pretty much everything that you see on your face that you're worried about. So uneven skin tone, sunspots, wrinkling, acne. It pretty much can do everything, and it can be fine-tuned per patient needs. There's different levels and depths that we can treat. And that's why we're excited to bring this technology to you. Christiana herself has about 8 years working with lasers, from CO2 lasers to other lasers. We have the Morpheus, and a lot of you guys have done the Morpheus and the Profound, so we're excited to add this on. So why did we choose this, and why do we want this for our patients? So I don't know if any of you guys have had CO2 lasers, but traditionally CO2 lasers cause a lot of heat and damage, and that causes a lot of downtime and recovery time. So the benefit of this UltraClear Laser is that it has a cool pulse technology, which allows for less heat. Probably like CO2 laser causes 60% heat per pulse. This laser is 5% heat and 95% ablation, and that causes skin tightening, contraction with way less downtime. Traditional CO2 laser is probably going to take about 2 weeks to heal. You're going to be like weepy. You're going to kind of look like Freddy Krueger. But with this one, the downtime is going to be like 3-4 days to like 5 days, and you'll be able to put makeup on day 4, and no one's going to know that you had anything done. So this is another thing that's exciting about the laser is we can treat all skin types. CO2 lasers previously were only able to treat skin types 1 through 3. We have a pretty diverse patient population, so we're excited that everyone all the way up to skin type 6 will be able to be treated without risk for post-inflammatory hyperpigmentation, which happens with a lot of lasers. So this is just a diagram that lays out on the right side the different modalities, and they can be mixed and matched. But the 3D Miracle is kind of like the lunchtime laser. We can knock it out in like 15 minutes doing your whole face, and maybe even the neck for an additional like 5 minutes. It's pretty quick. You don't even need numbing for that, and that just kind of gives you a rejuvenated layer to the top layer of your skin. The UltraClear is more for wrinkles, fine lines, also acne. And then laser coring is for those deeper wrinkles and sun damaged skin. So again, going over the different levels, we have the superficial level, which I talked about. You're gonna have very, very minimal social downtime. Like the next day you could go back to work and no one's really gonna know. You might see a little bit of flaking, whereas the moderate treatments, the Ultra, the Clear Plus, and the UltraClear, you're probably gonna have 3 to 5 days more of redness, a little bit of flaking skin. But the downtime is minimal compared to a CO2 laser. And then the laser coring, you can see in the picture, the before and after on the left, the deep wrinkles are treated and we get really, really good results. It's just a little bit more downtime, but not a lot of weeping of the skin. It's going to be mostly just a little bit of redness, maybe some track marks that'll eventually fade away by day 5, 6, 7. So this is a timeline about when the CO2 lasers were originally came out in the 90s, and then the YAG laser, which came out, and that's what the newer CO2 lasers use. Aclaro came out in 2018, and they developed UltraClear, which was launched in 2022, and it basically has the ability to do all of these things: fine lines, wrinkles, hyperpigmentation, scar treatments, skin resurfacing, and it's also been FDA cleared for vascular lesions and pigmented lesions as of May of 2024. So this video just shows the IntelliPulse technology. So the reason that it causes less downtime and less heat is that instead of doing one solid pulse of laser that causes skin damage, we're doing small micro pulses, and that's what allows us to control the heat, create less damage, less downtime, with results that are the same as what you would get with the traditional CO2 laser. There's different settings that we can adjust. The coagulation is basically the amount of heat. As you can see, the red arrows are representing that heat in the pulses. We can go lighter, we can go stronger. That's what this video is demonstrating. Right, this is a patient that we treated. Christiana, do you want to talk about this one?
Sure. So we treated our beautiful patient about 2 months ago, and she came in for acne scars and active acne. So as you can see, she's pretty comfortable. We had, we probably numbed her for about 30 minutes. And she's pretty comfortable. She's talking. We cover your eyes with goggles. We clean your face, we clean your neck, whatever areas, and then you could see we're all done, and we kind of just covered her face with a sterile saline to keep her cool after the treatment. It's pretty easy. It's not too hard, as far as this was like a moderate treatment I would consider, so not too bad. And here we're going to be talking about a few before and afters. So the lowest of the settings we call the 3D miracle. This is that lunchtime facial that Dr. Samaan was talking about. That lunchtime facial, minimal downtime, minimal. You don't even have to be numbing for this. We've done hands, we've done face, neck, and chest. I mean, pretty much anywhere, any area of the body that's experiencing kind of dullness or cracked wrinkles, around the body. It's pretty nice, and it targets all those little problems. With this patient specifically, you can see that she just looks more polished, more bright, and that pigmentation has also really, really calmed down. And this is just with one treatment, 1 month post. And this patient as well, you can see 1 month post one treatment. You can see that all the bumps and her little red pigment spots, they're kind of all gone and faded, and everything kind of just looks a little bit more clean and uniform. Our favorite, especially in Orange County, treating, the baby oil sunburn from the 80s or the 70s all the way up to now. We call them tech neck because we're always looking at our phones and we're always looking down. So we're able to treat tech neck with this. We can do anywhere from a very mild treatment to moderate treatments. It just depends on whatever the patient wants at the end of the day. Some more before and afters. So these are like the moderate treatments that we've treated. These are actually our own patients that we've seen in our own office. This is just after one treatment. This is an UltraClear with the laser coring. So we did the coring around her eyes. I don't know if you can see my mouse, but around her eyes, around her smile lines and lower jowl area. You can see that it's all lifted. Her pigment is pretty much uniform on her skin. It's not so spotty. And then the redness has definitely calmed down. Essentially what you're looking at after one treatment, that's pretty good for only 1 month result. And with the coring, which is a much more intense procedure, you're able to see results get better and better and better, even just after the 1 month. I've read with studies that they say up to 6 months. So you're still getting that collagen production happening. This is another one of our patients, just a little over 2 months. So we did lower face and neck coring with the UltraClear on top to help blur everything out. You can see her skin looks a lot clearer as far as her pigment goes. There's a lot less redness. And then also you can see in the jowl area, right over here, this jowl area got picked up along with the little turkey neck that also got picked up. We also did a little bit of laser coring in her eyebrow and eyelid area. So we did a little bit of coring over there and that gave her a physical lift right over here. This is our patient from that video you saw a little bit ago. This is just 2 months after her Ultra and 3D miracle treatment for her acne and acne scars. So you can see a great improvement there. She's a lot less red. And even her jowling, you can see got a little better and improved. So you're also tightening the skin. And she's a young patient. She's in her mid to late 20s. So, I mean, doesn't hurt. And this is also one of our other patients we just treated a few weeks ago, actually, for her acne scarring. So a little background on this patient. We did treat this patient about a year ago with one Morpheus. And just with that one Morpheus, her skin improved. But we're now just seeing 3 weeks after her first UltraClear and 3D Miracle for the acne scars. After just one, it kind of helped blur it and softened everything up so much more. And she's still healing. So there's still some healing left. You can even see she also has lessening of the jowls and her jawline looks a lot more defined. And then we call this under her eye in the before, that little line, that's a nasojugal groove. So that looks a little bit more filled and it looks like the collagen production has really kicked in for this patient as well too. All right, Samaan.
All right, so this laser also can be used to treat melasma as well as hyperpigmentation, dark spots. We also carry Lumecca IPL, which some of you guys have used before for some dark spots and hyperpigmentation. The difference between using the Lumecca is not really to be used for melasma because melasma is caused by hormonal factors, environmental factors. But you guys can see 10 months after 2 treatments, this patient has had significant decreases in pigmentation. Of course, melasma is something that's ongoing as the hormones are changing and environmental factors. So other treatments would also need to be topical treatments as well as the UltraClear combination will give better results. The next slide, I think, is another patient that also has melasma. Same idea. We're targeting pigment and we're taking away the unevenness of the skin. You can see the tone and texture of her skin is a lot better and the pores even look a lot better compared to the previous image. You can also use it to treat skin laxity in the hands. This is a before and after showing 3 treatments, 5 months out. You can see that the pigment in the hand has decreased significantly. Next slide.
Buenas. Para acá. ¿Este?
Yeah.
Sí. Thank you.
No problem. Sorry, you're getting an Amazon delivery, guys. So under the eyes over here, you can see that there's a little bit of we can pretty much do what they do, like a blepharoplasty, without going under the knife, without the side effects of anesthesia surgery. We can do it just with local topical numbing. We put drops in the eyes, and then we can cover the eyelid and then get really, really close up to the eyelash line, and we can get a pretty good result. We could also use treat hypertrophic scars. You can see 1 month after treatment, the scars kind of blending in, and the texture and the pigment is kind of becoming less after 2 treatments. All right, in this photo, you can see that the deep lines in the jowl region have significantly decreased. The deep wrinkles have decreased. Her jawline looks snatched, and her marionette line looks less defined, as well as the hyperpigmentation that she has obviously goes away with this treatment because it targets the layer where melanin is produced. All right, this is a video that shows a patient that we treated recently. We did coring around her mouth because she had a lot of those deep set smokers lines. And then we went on top of it with UltraClear mode. And then we also did 3D Miracle on top of that. So you can stack different treatments depending on what you're looking for and which areas of concern you have. And you can see, like, as you guys, I'm sure a lot of you guys have had Morpheus bias, we're pretty precise in how close we get the laser lined up, even if there's like a little small area that we miss. This shows the progression of the healing. So this, we did her chest as well. This is day 3, day 4. She could wear makeup. She still has a lot of redness on her chest, but by day 6, 7, that all goes away. And again, this is one of our patients that we recently treated. We did coring her entire lower face, like all the way from around here down to right below her neck. We got pretty close in there. She had more downtime because of the coring goes deep to the deep dermal layer. And then we also did 3D Miracle on top of that to resurface her skin. She had a really good result. She had a little bit more downtime than the other patients. You can see the progression here. Day 2, a little bit of redness is expected the first 2 days. But as the week goes on, all that redness fades. And this is 2 weeks out.
She looked good. All right, and then here are a couple other before and after photos. These are customized treatments. So again, this can be customized per any patient, but with this one, you can see a decrease in those facial wrinkles, the deep ones, the superficial ones, and then also that pigmentation. She just looks a lot more polished and a lot more clean. And this one is probably one of my favorite ones as well too, because I have a history with acne scars. So I have a soft spot for any acne scarred patients. So I am really happy when I see something like this. The deep acne scars, especially with this patient, you can tell these are very old acne scars. She probably had this when she was like a teenager. So for this laser to achieve, you know, I would call that like an 80% improvement. And it's just 20 days post one treatment. That's not even a full month. And she still has some healing to go. So that tells me that this patient just, oh my goodness, she's just going to have the best results ever if she doesn't have them already. Her pigmentation is pretty much gone and eradicated. And those acne scars improved greatly in those fine lines and deep lines. Even her jowls got picked up in this photo as well too. There's so much going on here. It really does make me happy when I see something like this. And this patient, I love this one. This is after 3 treatments of just the UltraClear, not even the coring. And as we age, we do lose fat, we do lose elasticity in our skin. So the neck really does suffer more so for a lot of people, especially in Southern California, because when we are in the sun, usually our neck and chest is always exposed. Most people wear hats and it just covers their face. So when we see something like this, that's able to be achieved with just UltraClear, that's pretty impressive. And this is 1 month post after 3 treatments. And this little guy, it looks like he hit his head on a table or something, poor kid, and got stitches and then has a scar after all that. So you're able to treat scars and pretty quickly too. This kid probably got 1 or 2 pulses real quick in and out. You're able to numb him probably for a good 20-30 minutes, and he probably didn't even feel anything. He looks pretty happy to me. So, and that scar looks like it's going to heal up pretty nicely and go away. This one is the UltraClear, and her pigmentation just looks incredible. Her jowls look a little lifted. The corners of her smile look a little lifted. And that pigmentation just kind of eradicated, and she looks nice, smoothed and polished, and that collagen production is just going to keep going and going, especially with that just being only 5 weeks out. This patient, also another good one, those jowls and the tech neck lines in the neck and the gobble gobble, we like to call those, and even under the eye, you can see that she has gotten great improvement with a skin tightening. She has this bounce restored from the laser itself just 6 weeks post 1 treatment. So she was able to achieve lots of collagen production, and it's still going to continue. So these are great examples of just what this machine is capable of doing. And that's not even including the coring. So if you paired this patient with a coring feature, of course, with a skin prep, you would probably, she would look like she got a facelift, honestly. And this one as well too. It's a great example to show how nice and bright she looks and softer. It kind of blurs and polishes everything. So yeah, looks great. And laser coring, this is a good one. Samaan, you want to explain this one? You're muted.
The laser coring technology, it uses pulses of energy that kind of burrow a hole in the kind of like a flower pattern that you can see there. And we talked about that earlier, the IntelliPulse, it just does 1 pulse at a time, and it creates these drill points that as the skin heals, it causes contraction, and that's how we get less appearance of the wrinkles and get rejuvenated looking skin. The benefit is that there's less downtime. You're not going to look like Freddy Krueger walking around for like 2 weeks. You're not going to have seeping. It's comfortable. It's very well tolerated. I actually had it done just above my eyes. Christiana treated herself and did her
that was nuts.
around her eyes as well. So it's pretty tolerable. She only numbed for like half an hour.
Not even. I wish I got to numb more.
Yeah.
I actually didn't numb my eyelids. I just wanted to see for myself the laser coring, and I did laser coring in my eyelids, and I didn't numb there. And honestly, it's very quick, very tolerable. I'm a big baby. I would probably say that as far as pain scale, it was like a 4 or a 5 out of 10. And because it was so fast, it was very, very tolerable. If it was something that took very long, it wouldn't be something that I could handle. But because how quick it was, I was like, all right, whatever, quick zap, let's go, move on. So easy.
All right, this patient was treated with laser coring. You could see the deep set wrinkles around the mouth, the marionette line, have all the nasolabial fold, they have kind of smoothed out a little bit. Hyperpigmentation has significantly been treated, which I think that's one of the drastic things that we see with all of these before and after pictures, is how how much the skin tone improves in addition to the texture and the softness of the skin. That's why we're super excited to offer this to you guys. It's not your average med spa laser. It's definitely dermatology grade. Again, laser coring. This is an older patient, probably looks like mid to late 70s. Turkey neck has smoothed out a little bit, tightened. Those deep set wrinkles are softened. And the tone and color of her skin looks a lot better. She looks like she's kind of glowing in the picture on the right.
Healthier.
Yeah, definitely healthier on the 5 minutes out. Again, same thing with laser coring. We're targeting these deep wrinkles, and as you guys saw in that animation video, we make these drill points, and then the skin kind of heals and causes this contraction, and that's how we go from the before to the after. It's just contracting the skin and bringing back that elasticity that we lose over time. Same thing in this picture, pretty much.
I think that's the same patient. Yeah.
Okay, in this picture, we talked about doing like a blepharoplasty with a laser. We get as close as we can to the eyelash junction, and you can see the fine lines under the eyes have definitely softened up just 1 month after treatment. You could also use it to treat crow's feet. And it's not going to be something that we could do multiple treatments if patients aren't satisfied with the initial result. We kind of target it to what your needs are, and we'll come up with a plan for you.
Yay.
So this is the offer that we have right now.
I think Hannah will
I'll let
take
you
over.
over.
Yes, I'm back. Great job, Dr. Samaan and Christiana. Thank you so much for sharing all of that insightful information on UltraClear. I absolutely love the before and afters and how much you guys have already been seeing great results for your own patients. So we have a special offer for everyone that joined us on the webinar today. So all attendees, if you book an UltraClear treatment in the next week, we will offer a free 3D miracle treatment on your hand. So you're going to see improved results there as well. It is another area where we're going to see signs of aging. And the first 5 people who book after the webinar will actually receive 20% off their UltraClear treatment plus the 3D Miracle hand treatment. We're super excited to offer this to you guys as a special thank you for attending today. And I will drop in this link here or the phone number here so you can text us. So you can go ahead and text webinar to 949-731-4586, and we'll get in touch with you to book your complimentary consultation, help you decide which UltraClear treatment or potentially which modes would be best for you. All right. And we also have a couple of questions, so I can share some of those with you as well. Okay. The first question is, what does after treatment care look like? Aftercare treatment. What are you guys recommending? Is there anything that's required?
Oh, yes. So after you definitely probably want to plan this kind of treatment on like a Thursday or Friday, so you can have the weekend to recover and just relax. I would say doing it myself, and Dr. Samaan also did it himself too, the day after, and I did a very intense treatment. The day after, don't go anywhere, stay home. So we'll send you home basically with you're ready to go to bed if you would like. But the day after, you would wash your face with a gentle skincare cleanser, very, very gentle. And then you would have some vinegar, white vinegar. Grab a water bottle, fill the cap full of vinegar and drop it in that water bottle. And then just use cotton balls. Leave that water bottle at your sink when you wash your face. After you wash your face, you use that vinegar water and you just dab it in your face. Make sure it's all clean. You stay away from pets in your bed, change your pillowcase, all of that stuff. And then you would just layer on top of the skin to protect it. You would layer on something like an Aquaphor, or there is a homogenic or what's it called? Hygienic. there's something like organic, whatever it's called,
Hypoallergenic. Vanaply.
hypoallergenic.
We got there.
It's Vanaply.
Thank you, Samaan. You know exactly what I was talking about. So we would send you to get stuff, you know, beforehand from the store, just so you have everything ready and have on hand like a good hydrocortisone. So, because there is an itching phase when your skin starts healing, it does get really itchy. So having that hydrocortisone at home really, really did help. After that, I would say like the third or fourth day, it's not too bad. It was pretty easy. You can kind of go back to your skincare routine if it's not too aggressive. So yeah.
Okay, great. We had a question come in here as well. Someone had shared that they did the CO2 laser, and it was incredibly painful. And then she was sore for about 3 weeks. Can you compare UltraClear to a CO2?
Samaan, did you do a CO2 yourself?
I've never
Ever?
had one done. No.
I have, and that was
Go ahead.
that was probably, I would never do a CO2 ever again after that. I was out for 3
Wow.
weeks. So I understand your pain, whoever that was that asked that question. The UltraClear, I did a coring with an Ultra Plus laser on top of that. My downtime, I would say by the 4th day, I was okay. I was fine. I think I went furniture shopping day 3 and I just wore a hat. And everyone could tell I got laser. You're just a little pink and whatnot, but you're definitely not incapacitated like you are with the CO2. With the CO2, you can't go anywhere. Your face looks like you've gotten eaten off, and it's very uncomfortable, very painful. You're weeping blood and water for weeks. I think my downtime in total was a good 3 weeks. And then I was finally able to be a little bit normal, but I still was weeping for a couple of months, even after that. But with the UltraClear, no, you're fine. You're going to be fine after, let's call it a week at tops.
Okay. Thank you for that. I know the CO2 is very aggressive and kind of intimidating. So it's nice that we have UltraClear now. Another person asked if this removes a layer of skin. Oh, you're muted.
Removes the skin. You know, you do feel a little, well, depending on the setting, you're able to customize it. If it's like a lunchtime facial, it's not like you're removing skin and you're going to be all bloody. No, if you're doing the more intense, like the UltraClear with the coring, you are going to appear a little bit more raw, but you're not going to be removing physical skin. It's more kind of like just, you know, lasering overall skin. I don't know. How would you answer that, Samaan?
I mean, we can target it to like do 30%, 40% of the skin.
Yes. Coverage.
But you're not gonna feel like your skin's peeling off.
No.
Yeah, you're not going to be like a CO2 patient where it's just completely ablative. This is a non-ablative laser, which is pretty cool technology.
Another Q&A or question on here. Can you do all 3 modalities at the same time to get the best results, or you just need coring or one other setting? Can you explain like how you decide which modes are best for some patients?
At consultation, we would definitely see what you want out of your skin to look like. And you're able to customize and layer. So what we like to do is do the coring, and then let's say we would do an UltraClear on top of it, or a 3D miracle on top of it. It just depends on what the patient wants, but yeah, you're able to layer.
Okay. And a follow-up question to that was, how much is the consultation?
Complimentary.
Complimentary. We love that. Okay. Would you say that results are improved if you do multiple modalities or modes at once? Yes. Sounds like dramatically.
If you do the lunchtime facial, you'll see a difference with just one, but with 3, you'll notice a big difference. If you do an intense coring UltraClear layer on top, you saw our patient photo before and afters. Those were just one treatment with our patients only, not the ones that were provided by the company as examples, but you'll notice a big difference. Oh yeah. Oh yeah.
Another question here is, can you do UltraClear and Botox on the same day? Can we stack our appointments?
If you do 3D Miracle, it's lunchtime facial, sure, great. If we're, going ham and you have an UltraClear plus a coring plus, you're not going to want to put a needle to your face after that.
Yes, agreed.
Yeah.
Can you do other parts of your body outside of your face with UltraClear?
Yeah, I
Samaan, you
mean,
want to answer this one?
You could definitely, like we said, we're offering it on the hands. We can do it anywhere on the body where there's skin laxity, where there's hyperpigmentation, scarring. It just rejuvenates your skin. And there have been lots of studies. I've attended lots of conferences prior to choosing this laser, dermatology conferences, one called Masters of Aesthetics that's put on by Harvard Dermatology Fellowship Program. And they've done lots of studies that show these CO2 lasers actually have been found to decrease your risk of developing skin cancer, because when we're stimulating that new collagen, the new elastin, it's actually protective to the skin from UV radiation. So we can treat any part of the body that anybody is concerned about.
That's great news. Okay, another question here. Can I do UltraClear if I've had a facelift, or you had mentioned a blepharoplasty earlier as well, Dr. Samaan?
Go for it, Samaan.
Yeah, I mean, we'll consult everyone on a basis to basis, but there shouldn't be any restriction unless somebody has had multiple blepharoplasties or multiple facelifts and the skin is starting to thin out. But even then, we can cater the depth and the energy that we're using. You're still going to get good results. So I would say no, and that we would just kind of cater the energy that we're giving to give the patient the best results that they can achieve.
Okay, awesome. One more question came in here. If I do 3 smaller lasers, would it equal 1 big one? So if someone does 3 3D miracles, for example, is that the equivalent of a laser coring?
No,
No.
because remember at the beginning of the slides when Dr. Samaan was talking about the epidermis, the dermis, all the layers of the skin, the 3D Miracle only goes to the top. It won't penetrate down deep. So if you're wanting to address anything deeper skin issues like acne scars, deep wrinkles, heavy lifting of the skin, a 3D Miracle will not do all those physical changes. It will help blur and lighten the skin and offer a brand new, beautiful, glowy skin, but it's not going to give you that physical, that lifting that we've seen with the more intense treatments that is offered with that machine.
Okay. Thank you guys so much. This was great. I think that we have answered all of the questions that we've had come in today. If you have any additional questions, please go ahead and reach out to the practice. And as we have still up here on the screen, we would love to hear from you. So please text webinar to 949-731-4586. And then you will hopefully be the first 5 people in to come see Dr. Samaan and Nurse Christiana to get their UltraClear treatment with the 20% off discount. Thank you all for attending today. This was a great webinar. Thank you, Dr. Samaan and Christiana, for hosting us.
Thank you guys for taking part. We hope to see you soon.
Take care. Bye.
All right. Bye-bye.